Hi there, I'm Dr. Chris Rayo of Unison Pro-Youth Institute, located here in wonderful West Palm Beach on Flagler Drive. And today we'll talk about differences between us and other medical practices out there. Being a board certified family physician, we treat the gambit of things, and it's about long-term relationships with the patient, trust, making sure that you get the most effective and safest care out there, and that's been my paradigm, one of them, since day one. I never lost track of one of the most important things that they taught me in medical school, which is to listen to the patient. We'll learn the most from them. And I can give a big thanks to my patients in the past because they led me along this path of what's more of an integrative way, a functional way, not just medical ways or surgical ways to optimize one's health, being more proactive, preventative, as opposed to reactive. Reactive is not good because why get chemo or get your chest cracked open for a bypass if you don't have to? And there are a lot of subtle changes out there that to the astute clinician that's specially trained can pick up on that and can help you out before something bad occurs. So proactive to listen to what the patients, what they would come in to tell me, that they tried these natural supplements like glucosamine and chondroitin for their joints, and the orthopedist was wanting to replace their knee, but they tried this and some physical therapy, and their knee is fine. So I didn't have to get the operation in the first place. More of a proactive course of action that's safer and more effective. Anyway, proactivity, meaning to help to prevent problems. And unfortunately, in medical school, we're trained to treat pathological disease, right? We're trained in the hospital, the sickest of the sick, way after things could have been intervened upon and prevented. So we're trained to really treat pathological disease, not really what this is about. What Unison Pro-Youth Institute and my whole focus is on proactive things and to optimize your health. Like if you look at A, B, C, D, F, most of the time physicians are trained once you get an F, like a pass-fail. For me, it's to optimize your health. Most people that come in, they're used to feeling A+, but now they're starting to feel like a C, starting to lose that edge, the energy that they used to have, the drive, etc. And they know that things aren't going quite well for them. They're used to feeling A+, right? So they're feeling like kind of tired, a little bit of achy, concerned about this and that. And they go into the regular physician that they do the same lab work for everybody, a one-size-fits-all. A CMP, CBC with diff, they may check a TSH or not. They would know probably what to do with it once it comes back, but anyway. And you go back and they say, everything's fine, everything's okay. And so, but you know that things aren't okay. And do you really just want to feel okay? Or do you want to feel great, like an A+, to optimize your health? When we optimize your health, looking at mind, body, and spirit, if we optimize your body, one of the things I'm very concerned about and focus my blogs and such on is mind health and brain health. If you have a healthy body, the brain being part of that, for example, helps to promote a healthy brain. When you lower inflammation, toxins, etc., your brain can function the best it can. And if you visit our blog on brain health, you'll find out a lot more about that. But I'm trying to explain to you what the paradigm shift is here, is that we can optimize and we can reverse a lot of the signs and symptoms of aging, especially when it comes to premature aging, the symptoms of that. And that's been proven time and time. Now, we can't reverse the chronological clock, of course. When you're born, that's the date you're born. We can't change that. And in my books, if you look at those, the Midlife Health Guide for Women, kind of run through that some. Like we said, the chronological age is like MC Hammer said, you can't change this. Little joke there. And the Midlife Health Guide for Men, this was the first one I wrote because at the time they only had one men's health book out there. And it's about proactivity because there's so much lack of information, and then the information I had, a lot of it was disinformation. Like people extrapolate research, and let's say if the research shows a Mediterranean diet that's high in vitamin E and C and such helps promote your health, it's anti-inflammatory, helps reduce your risk for heart disease, for dementia, for metabolic syndrome and all that, a lot will extrapolate and say, well, if you take a supplement like C or E, that's going to help to do the same thing. And that's not the case. So I'll look at the research and the books and all the things on the website and blogs has those references so that you know we're talking about the facts here. Like that old show Dragnet, all we want are the facts, ma'am, right? Anyway, so that's the paradigm shift. And to switch things a little bit, why don't I accept insurance? That's a very good question. Health insurance is really sick insurance. A lot of my patients, they don't want their medical information, despite with HIPAA and all of that it's supposed to be. Everything is filed to insurance companies. That goes most of the time to the government as well, to CMS, the Center for Medicare and Medicaid Services. So as far as all that goes, I don't believe it. It's a crock of feces, I guess you could say. So here, everything is kept confidential. With typical health insurance, you have to be sick first, which means you have to have a diagnosis code to get lab work checked. So how do you know the person has it unless you check it? You hope it's negative. If it comes back a negative result, you can almost have to say, well, I got some good news and some bad news. You don't have diabetes per se. You may be in a pre-diabetic range or such, but that's probably good news, but you're going to have to pay for the lab work. So for us, we just found that it's better not to have insurance to pay for it, and to keep your health information strictly confidential. Another thing is that we spend the time, most insurances and offices, if you even get to see a physician, there are 6-minute time slots. We want to spend the time that you need and listen and to come up with a mutual plan. That does take time. Other physicians can make a lot more by just hiring mid-levels to do the job, and I'm not knocking that because they do a great job, but they're not a physician. We spend the time and we guarantee that you'll feel better with things. Since day one, I've always had a money back guarantee. If you don't think that we did the things that we said we were going to do and such, you get your money back. Please see the web for details because you would have to pay for the lab work. Anyway, proactive, looking to optimize your health. Brain health, of course, something that's underaddressed grossly in today's medical system, as well as women's health. You hear a lot of talk about it, but it seems like it still is lacking in many things, and you can look at our blogs for more information on that. Well, anyway, this is a little touch about the paradigm shift. We spend the time, as far as my qualifications, my CV is on the website, but I've taught for National Procedures Institute, for the A4M many times, author, lecturer, radio shows. I was a medical director and lead physicians for WellMed, which is a division of Optum Health, to try to increase value medical care and such. So I have the experience to help you out. Anyway, please come on in and email and to check us out. We're more than happy to help you out. We've helped out many. We know that we can help out you. Thank you so much.